to my channel. It's Coco here. So today I will be speaking on a very recent situation in the surgery community. If you follow both parties, or if you're sort of into sort of surgery, cosmetic surgery, you're gonna know what's going on. So it's this whole situation between the popular influencer Miss Arfab and Clinichub. Now, I watched the video that Miss Arfab made, which is her BBL regrets video, and I also tuned into the live that Clinichub did between Dr. Furkan, who is the surgeon that actually performed the BBL 3 times on Miss Arfab, and another coordinator. So I watched that, where he was sort of responding to, you know, some of the allegations or some of the situation that's on the situation that's been going on, and some of the allegations that have been put against him. So he was speaking on it. He didn't really say too much about her particular situation, about Miss Arfab's particular situation, and he didn't really go too much into detail. He didn't really answer the comments in the live, you know. I didn't really answer too many questions in the comment section. He just spoke, I think he spoke very broadly, he spoke like in general about complications in general. He didn't really talk about her complications in particular. Now today I've sort of watched I've watched the video that Miss Arfab made, and I just want to be speaking on a few things that I heard her sort of say, a few points that she made in the video, and a few things that she said in the video. So I myself, I've actually had a cosmetic procedure done, a couple procedures done. My most recent one, it was a rhinoplasty in Turkey with Dr. Bora. I have a few videos on my page already, which is a review of that procedure, and I've been lucky enough to not have any complications whatsoever. I think in total, plus my rhino, I've had 3 procedures in total, and I've not had any complications so far. So, and I know obviously sometimes complications can happen to anyone, you know. Sometimes there are a few factors that can contribute to you having complications. There are lifestyle factors, there are health factors, there are post-op care factors, and sometimes you can do everything correctly and you still have complications. Anyone can have complications, you know. But you know, in this video as well, I will try to speak about some of the things that you can do to minimize getting complications. I will be speaking about, you know, how to pick a good surgeon, you know, what are the things that you can look out for, and what are the things that are red flags in terms of when you're researching a surgeon, when you're trying to pick a surgeon. And also some of the things to do post-op as well, that can help you minimize your chances of getting complications. So let's get started, guys. So guys, I've actually thought about it, and I thought about doing this as more of a reaction video to her video, because I didn't want to sort of get anything misinterpreted or misinterpreted or misunderstood, or, you know, just say it the wrong way. So I just wanted the video to actually play, and then actually just tell you guys like what I think, because it's not everything in the video that she made that I agree with. There are some things that she said that I was like, that doesn't sound right. But right, I just want to go into this just to tell you guys how I feel, because I feel like I have a bit of experience doing this. I mean, my first procedure was in 2017, so I've sort of been in this thing for like 3 years constantly. So I kind of know it, and I've been post-op like 3 times for different surgery, you know, some for 2 procedures on my body and 1 on my face. So trust me, I know I kind of have a good idea what I'm talking about, right? In this situation, so I'm gonna say, first of all, I feel like both parts, I mean, when you as a person go and get a procedure done, a cosmetic procedure done, typically what girls do, our age or my age, is a lipo and a BBL, right? Typically. So I'm going to specifically speak on those two procedures, right? A lipo and BBL. When you go and get those things done, there is a bit of responsibility on you as a person, you as a patient, to number one, declare any health situations that you might have, any health conditions, to tell you have a responsibility. Just like the surgeon has a responsibility, you have a responsibility to tell the surgeon the truth and nothing but the truth, 100% truth. Declare any medications you're taking, any medical conditions you have, any medical conditions in the family that runs in your family that you are aware of. So maybe what's this thing called? I forgot the name for this procedure. I think it's a deep vein thrombosis. This is blood where people can get blood clots in their legs. So that's like a condition that kind of is can run in the family. It's a hereditary thing. So you should declare that, you as a patient, you should tell your surgeon if there is a risk of that in the family. So there are some things that you as a patient, you have a responsibility to, just like the surgeon has a responsibility towards you. You have a responsibility to tell your surgeon the truth. Some people in the surgery community, there are some people that lie. So it's either because they are afraid that, if they tell the surgeon, if they give the surgeon this information, he's not going to want to operate on them anymore. So they just don't tell him. They just withhold that information. They just lie. They lie or they just don't tell their surgeon. And that's another thing where the responsibility of the surgeon comes in, where he has to test his patient. Now, I know there's a limit of things that the surgeon can test for, right? All surgeons and anyone that's going to operate on you, they do a blood work. I don't know how comprehensive or how detailed that blood work is, but they do a blood work, right, where they do a blood test on you and they try to check the oxygen levels of your blood, and I don't know, some other things that they test for. So even if you withhold some information from the surgeon, there are some things that blood test that they do can tell them, right? But there are other things that a blood test cannot tell them, right? For example, my last procedure that I did, which was the rhinoplasty that I had, I was actually taking a certain medication before that surgery was coming up. But I had to tell the doctor to say, okay, I'm using this particular medication. Can I continue using it or do I stop using it? There's a possible risk that the surgeon would have said, you know what, we can't, because I think I only told him like 20 or 30 days before my surgery, because I didn't even think about it, I forgot. But there's a possibility that when I told the surgeon that, he probably would have said, you know what, for safety reasons, let's postpone it, or let's push it, or let's not do it right now. But I still told him anyway, because my safety is more important than anything else in this world. So when I told the surgeon, then he advised me to go do some blood tests in London, because my surgeon was in Turkey. He instructed me to go do some blood tests in London and send him the results so he can see and read the results, and he can tell me whether we're going to go forward or not. And I did do that, and he did tell me, okay, let's go forward. Some people, maybe they're scared that a surgeon is going to maybe postpone or cancel their surgery. They hold information, and it's not every single thing that the surgeon can find out from the blood test, right? So that's number one, your responsibility. The surgeon's responsibility, I think, is greater than the patient's responsibility, because from a medical point of view, the surgeon knows more than you know as a patient. They're the ones that went to school for 8 years or so, for like a long time, to know this type of information. So they should know more than me as a patient, more than their patient. They should know more. So even if a patient is pushing for something and saying, I want this done, I want you to put fat in my thigh, I want you to do this to me, I want you to do this to me, or they bring you or you take a wish pick to a surgeon, it is the surgeon's responsibility, or based on the surgeon's knowledge and what they know and what they've gone to school to learn, right, to tell their patient, to say, based on the body type that you have now, I don't think the wish pick you brought to me is realistic for you. And I know some patients can be quite like, I don't know what the word to use for it is. They can be quite like pushy. They can be very like adamant on what they want. But it's the surgeon's responsibility as the person with the actual technical knowledge to say no, to manage expectations and either say, no, I can't do this at all, or no, I can't do this in one round, or no, I can't do this in your first round. So that's number 2. And in terms of looks and in terms of safety, to actually check, to do what they can do, as much as they can do on their part, to know that, okay, I've checked this patient, I've asked them to fill out a form, I've asked them to sign the form, I've done the blood test on them as a surgeon, I've done everything that I should be doing and I could possibly do to keep this patient safe. Now, I think I've covered what I wanted to say there. So moving on, I'm gonna do this as more of a reaction video, just to tell you guys, just so I can really cover, most of the things in the video. So yeah, here goes.
At all when I was promoting them. The moment I started having complications, and the moment I started to notice certain things was wrong with my body, the moment I started to notice that their behavior changed towards me, I stopped promoting for that company. I also stopped working for them the moment I realized certain stuff. You guys know me very well on my channel. I'm not gonna fake or sugarcoat anything. I don't have anything to lose when it comes to this company, so I really do not care at this point.
So based on that situation, where she's saying that, she used to promote for them, and sorry guys, I live in London, that happens a lot. So sorry. Right, so continuing. So the first thing from that video is her saying that she used to, and also sorry if you can hear a lot of noise from the like cars and stuff. I live on Earth. It's regular, it's normal. Sorry. But yeah, moving on. So she's saying that she used to promote for this company. And when she was promoting for this company, she personally did not have any issues, which is a thing that I want to speak about. So and I'm sure the issues with Clinichub didn't just start now. People did not just start raising issues with this clinic, with these people. It's not new. And I'm sure at that time that she had her procedure with them, there are girls that already had been speaking up. So if she's saying that if she never had any issues personally, she would have just carried on promoting these people. She would have just there are a lot of people in the surgery community, a lot of people that will not even disclose their surgeon to you. And this is because they don't want to, picking a surgeon is not something that you want to do based on this person went to them, so I'm gonna go to them. That's not how this is supposed to work. You're supposed to find out yourself, research yourself, know that you've looked into this person, you've read every single reviews, and there are platforms that will allow you where people can put reviews. Real Self is one of them. A lot of people know Real Self. A lot of people upload. Some doctors have more reviews than others because obviously they're more busier than others, but there are these platforms where you can go and read information. You can do research on YouTube, you can do research on Real Self, you can do research on Instagram. Some Instagram people might not be as willing to disclose information, but there are surgery pages. A lot of girls will set up surgery pages specifically for their surgery journey, and some of them are willing to talk to you more than others. So if you speak to them, so if you ask questions, some people can ask, some people are more willing to answer you. Remember that nobody owes you any information and nobody owes you any time. Me personally, I've said it with my last procedure, I'm absolutely willing to answer any questions. Like, you can ask me as much questions as you like. Most things I've covered in the video, but if there's anything that I haven't covered, feel free to ask me. So that's one. You can do research on Instagram, follow people's surgery pages, right? And that's back to what I was saying, because I just lost my train of thought. Right, back to what I'm just saying. Picking a surgeon is something that you should do by yourself. Do not go because they're offering cheap surgery, discounted surgery, because you saw one of your friends go to them. Your friend could go to this surgeon and be fine, and you could go to this surgeon and have a terrible time, because everybody is different. your body, your anatomy, the setup of your body is different. So make sure that when you're looking at a surgeon, you pick based on who's good for your body type. Some surgeons are better with bigger girls. Sorry again for the noise. Some surgeons are better with bigger girls, and some surgeons are better with more petite frames, with smaller people. So look at what they are doing. If your friend is small and she goes to this surgeon and she gets a good result, you can be a sort of thicker girl like me and go to this surgeon and just have, you know, not be happy with your results. So do your research. Make sure that whoever you're picking is between you and yourself, someone that you are happy with. Read the reviews very, very, very well, and I will go more into detail, I think, later on, in terms of reading reviews and using reviews to make your decision, because it's not every single surgeon that's gonna have 110% positive results. It's not possible, right, for every single patient. If a surgeon has been doing surgery for 1, 2, 3, however many years they've been doing it for, it is not possible that every single one of their patients will be 110 or 100% happy with the procedure. There are some patients that will just always be unhappy regardless. But there are really objective reviews in terms of, like, the reviews, they tell you the truth. They tell you the good parts, they tell you the bad parts of it. If you see, I mean, let me just hold it. I will go more into detail later on. Let's just carry on with this video.
Just make it clear, I don't work for the company anymore, so I just want people to understand that. I stopped working with them, stopped promoting them, stopped doing everything that will benefit this company. The moment I realised that they didn't care about nobody but themselves, and they only cared about taking people's money. People care. Like, even me, that's an influencer and that has a big platform, they didn't care about me either. So don't feel like, oh, because Renee's got a platform, or Renee's known or whatever, that they treat me any different. No, they don't. The only thing that I would say is, majority of the stuff they did pay for. So I would hold my hands up and say, yeah, when it came to, like, my hotels, stuff like that, complimentary food, they paid for it. But then again, it's only because...
And another thing that I'm trying to figure out, when she was doing promo for these people and they were paying for her surgery, she was doing promo for them, was she telling the truth to people to say, this is paid? And I know Instagram has that whole transparency thing where you have to say an ad is an ad, but I'm saying back then, I don't know how far back this was she really telling girls that she was influencing and sharing this information with and putting this clinic in a positive light? Was she really telling them that she was being paid? Were they aware that she was being, or that they were giving her free surgery, or that there was an incentive for her to say these positive things about them? Because if not, and I know in the video, further down in the video, she apologized, for what she said, but also that's really irresponsible. She said she's sorry, we're gonna drop it, but it's just not a great thing to not be transparent like that with your people, with your girls. If you call yourself an influencer, that transparency is kind of required, isn't it? Anyway.
Because I was pushing their platform. We had a really good relationship with both ends. It's only when I started to realise certain things about the company, I took a step back. It's only when I started to realise that the company was moving a bit wrong and doing certain things that I didn't agree with and I didn't respect. I then decided no longer to promote this company. I decided no longer to work for the company anymore. Looking from my first ever YouTube video, I believe that video was on my YouTube January 23rd at the time. I then got arrested at Heathrow. Everybody knows that situation, that obviously my back was damaged and it was killed, it didn't make it. So that left a permanent scar on my body. After my 3 months of seeing my results and stuff, of course I was not totally healed yet. Now, as a clinic, it is your responsibility to let it be known that you are not in no state to do surgery again because you've not healed yet. Now, to my understanding, my bum was healed at that time. It was fluffy, it was moving, it was bouncy, it was healed at that time. They asked me to come back to Turkey so that they can rectify the mistake and to fix the problem. At this point in time, I've now done my second BBL, and when I've done my second...
So the second BBL was 3 months after the first one. I don't think 3 months is enough time in between. Obviously now in hindsight she knows that 3 months was not enough time, and I'm just really just baffled is the word I'm looking for here as to why the clinic, a qualified surgeon, would ask a patient to come back in three months. I think minimum is 6 months. Like 6 is the least amount of time that should be in between any couple procedures. 6 months. Some procedures ask you to wait 2 years between rounds. So 3 months is already making me think that his judgment is a bit questionable. But let's carry on.
More fat out of me to put into my bum, obviously to replace the fat that they took out. Now, when I did my first BBL and I was healing, I realised that they didn't do what they was meant to do. So I asked for a BBL. In case you don't know, a BBL means fat removed from 2 areas transferred into your buttocks area. Now, they only removed fat from my lower abdominal area. They didn't remove fat from my upper abdominal area. 60. I asked for a 360 liposuction in my stomach, all here, up and bottom, and my back. Now, the clinic only did my lower stomach. They didn't do what they was meant to do, and they only transferred it to my bum. At this point, I didn't realise, of course I didn't realise, you know what I mean? Like, I didn't realise that certain things was not done. I only realised when I got back to the UK and days have gone by and I'm changing them and I'm doing my thing, having a shower, and I'm looking at my body and I'm thinking, okay, certain things that I asked was not done. So I reached out to the director and I said to him, what is this like? I've got a dent in my bum. I told him the situation. He understood. Obviously, I'm not blaming the dent on.
So in this situation, I would sort of think like, because I personally had something similar as well, where I had the first round and then I thought, okay, I need a few tweaks. Not that anything was wrong with the first round. I could have just rocked that. There was a lot of people that was telling me, no, you're fine, no, you're fine, no, you're fine. But I was like, no, I just want a few more changes. That's not because I looked wrong. I just wanted something more. But what I'm trying to say there is the fact that if there was something wrong at the first round, the surgeon could have thought about it to say, is it a frame situation? Is it your body type situation that's wrong here? You know, because if you've done something once and it didn't work, and the patient wants to come back again, not to say don't operate on the patient, but like ask yourself, is it the patient's body type that's the issue, or maybe try another sort of look. I don't know. Anyway, I'm just saying.
On the surgeon, I'm not saying it's their fault at all that I've got a dent, because I know what happened to me and the situation I was in coming off the plane. But I didn't get a 360 lipo, and that is what I asked for, and I didn't get it. So the second time that I went to Turkey, I had to correct all those things. And people are just thinking Renee got lost in the sauce and she's just out here doing surgery for the sake of doing surgery. No. The second time that I went to Turkey, I specifically went to Turkey for them to correct their mistakes that they didn't do. So that was them doing the upper abdominal area. So I didn't have no fat underneath here. I didn't have no fat underneath my lower abdominal area. But at the top sections, all the way, I had so much fat and I just didn't understand. So went back, they removed those. They did a 360 live in the beginning. Their page, okay? So I expect.
Anyway, I'm gonna fast forward the video because if you want to see the full information, just go on her page. So the gist of the situation, to me, the way I see it, is that that clinic, right? They've had a lot of complaints. If you as a person, or as you're thinking about going to them, I'm not gonna say don't go to them, because I know you might have made some financial commitment in terms of like paying a deposit. I'm just gonna say, I don't know what to tell. I don't know what to tell you. Maybe have a rethink I'm not saying don't go to them. You could go to them and you could be absolutely fine. That's a possibility. You could be one of the lucky ones. But maybe just take a breather, you know. Just I don't know how to put it. Just take some time in between. Just, you know, maybe push your surgery back a bit more. Take some time and really maybe try to see if you can find alternatives. You could still do all of that and still decide to go to this person, these surgeons. And I know it's not just one surgeon. They have multiple surgeons. But I'm just saying, as a group, right? The reviews that people have been hearing about them is just not the best. And I am aware that it's not possible for one surgeon to never have any complications. Just like the surgeon said in his live yesterday, complications are normal. But the problem is when you start to have a high volume of complications. The ratio is what you need to look at. How many people are you operating on, and how many of them are getting complications? That's where you really need to start asking yourself the question to say, like, what's going on? Why and what type of issues are people reporting? It seems like a lot of people are reporting sort of necrosis, infections, fat migration. So if it's recurring, multiple people cannot be having the same exact issues. Then maybe as a surgeon, you should sort of look inwards and think, okay, what am I doing that's not right? What can I improve on? That's the only thing I would say. So when you're reading reviews of a surgeon and you're seeing a lot of the same issues coming up for multiple people, then you should start taking that seriously. That's a red flag. That's a red flag. That's all I'm going to say. If you see a review that's written in detail, someone that's out to tear down the surgeon or creating a fake page just to give the surgeon a bad name will not really take too much of their time to write a detailed review. When you see a review that gives you date, time, describes the clinic, describes the procedure, everything, like they put a lot of detail in it, you know that it's a legit review. If it's a fake review or someone that just wants to just be a hater and just tear the surgeon down, they don't have time, you know. It will just be shoddy. There will not be a lot of information or a lot of detail in it. A legit review will give you detail, a lot of detail. So if you see that for that surgeon, that's how you can spot a proper review, a legitimate review to a fake review, right? So if a surgeon is getting the same type of issues for multiple people, just consider that there's a problem there, okay? If you are seeing a lot of bad reviews for a surgeon, maybe because there's a problem there. If you look at pictures and you see people with your body type, right, that's the best way to judge the body type. If you had the same body type as someone and they went to your surgeon and they had good results, there are chances. That's just based on body type or not based on medical situations, right? You know that the surgeon has a lot of experience working with people with your body type, and you know that you're likely to get good results based on body type, not based on medical situation, right? And then moving on, something else that she said in the video that really just, I don't know, it just made me feel a way, a certain type of way, was when she started advising young girls to go to the gym. That was tacky. That was corny. To me, anyway, that was corny. Because, like, my page here, my surgery page here, my channel, it's a pro surgery space anyway. To me, I feel like people should go and do what they want to do. I encourage people, I encourage girls, I encourage women to go and do what they want to do to their bodies. Do what you need to do to make you feel good about yourself. 1 second. I'm gonna go shut this window. This noise is pissing me off. 1 sec. Right, so now I'm back. It's still a bit noisy, but it's a bit better than it was before. Right, so now I'm back. As I was saying, this channel anyway is a pro-surgery channel. Me personally, I believe that women, girls, young girls anyway, should really not get so influenced by body image and what they see on social media. That bit is correct. I agree with that. But I feel like if you get older and you still have that mindset and you still have it in your mind that, you know, you really want to get something done, we have to understand, like, the way society is, women are not just deciding to do things, you know, out of the blue. Some people, me personally anyway, the way I look now is how I've always wanted to look. It has nothing to do with society, you know. Even if people didn't, even if this look wasn't in or anything, I would still want it. This is how I always imagined myself looking. This is how I want to be. And for me to look in the mirror and see what I'm happy with and what I'm satisfied with is really important to me. So I always encourage women to say, if you can afford it and your health and nothing is at risk, do what you want to do. Because if you don't do it, then that's how people turn into haters. That's why you're gonna have a girl or something that just sits there and just hating on other girls, because you want that. You know in your heart you want to look like that, but it's either you're too scared, you're too broke, or I don't know, or maybe you just can't do it for whatever other reason. So if you really want to do something, you really go for it. What I advise people to do is to do proper research and go to a qualified surgeon, a proper qualified surgeon. Don't make your decision based on price. Don't make your decision based on somebody influencing you or somebody giving you a discount or anything like that. Do your research and pay your monies. If you have the money for it, you can afford it. If I couldn't afford any of the procedures that I had done, I'm not going to kill. What am I going to do? I'm not going to kill myself. I'm not going to hate myself. I'm going to love myself and I'm going to live with it, because I don't have a choice. I know that if I could, that I would, because now that I was able to, I did. But if I couldn't do it, if I assume I couldn't ever do it, I would never be hating on other girls. It would be like, and I would not be advising girls as well based on one person having complications or me having complications. Say, oh, just go to the gym. It's not all bodies that are made in the gym. Not everybody wants a gym body type. I don't want a lean body. Me personally, I don't want a lean body or all of that stuff. I want to be, if anything, I want to be smaller than I look now, a bit skinnier. But that's it. I don't want to be lean. I don't want to lose any of my fat. I don't want to lose any of my thickness. I like the way I look. So when you're telling people going into the gym, it's like, first of all, not all issues can be solved in the gym, and not everyone wants a gym body type. Some people have loose skin. Some people have had kids and they have skin that's loose. Some people have lost weight and they have loose skin. You can't tell this kind of people going to the gym. What's the gym going to do for them? That is no solution for them. What people need to focus on is going to a qualified surgeon and managing, your expectations and doing your part of the surgery. As I said earlier on in the video, declaring any issues that you may have, any health issues, making sure you tell the doctor what's going on with you. Ask the doctor if you need to take in any supplements, if you need to stop smoking. Some people need to stop smoking before they do their videos. Some people, I don't know, is smoking shisha advised? I don't know. Anyway, I know people want to live life and all of that stuff. And I personally, it's not really every single post-op advice that the doctor gave me that I followed. Me personally, they tell you don't sit on your bum or something for a month. I started sitting on mine maybe the week of or 2 weeks after. It's not everybody that follows rules, but there are some things where you should sort of use a bit of common sense, a bit of discretion in it. If you're smoking when you're just post-op, it's not going to help your fat survival. It's not going to help your fat keep. Already as it is, if you're living even healthy lifestyle, it's only maybe 70% of the fat that survives. If you're then smoking on top of that, you just reduce your chances by another God knows how many percent, maybe another 50%. You're not helping yourself at all. Fat migration happens. It can happen to anybody, to anyone, right? But if there's any issue, maybe there's more of a, maybe there's an infection issue, or it's migrating more than where it should, maybe the wrong place got, you know, injected, that might be the surgery situation and not really to do with post-op. Post-op care is really important, but that is not the end all and be all. You need to make sure it's a 50-50 thing, right? Two things need to come together properly. Your surgeon needs to be really good, really careful, really qualified, great at what he does, and you as well need to bring yourself in the best state that you can be, in a healthy state, and, you know, do the surgery, take care of yourself post-op. Those are the two things that can come together to give you good chances, and you can do these two things and you can still get results. Then that goes back to how this thing is managed and the response and the communication between yourself and the coordinator, or yourself and the surgeon. In the case of this clinic that, you know, Renee was talking about, they don't have great customer service. From what I've seen from the text that she's shown, their customer service is very lacking. You cannot have anyone that you've paid money to, that you've trusted with your body and your health, speak to you in that manner. Customer service is really important. Compassion and care is really important. You cannot dismiss what your patient is feeling. If your patient is saying that they're feeling pain, you need to take that into account, and you really need to investigate and find out what's going on with them. Don't dismiss it and say, oh no, you're fine, or no, it's normal. Because what if it's not normal? You know, what if fat migrates somewhere and blocks a vein in her leg and kills the person? Are you going to wait until the person is dead before you take it seriously? So you need a surgeon or a clinic that's really that just takes your life and your health and your well-being very seriously. Without that, it's almost like you're doing this by yourself, and it really can't work out. Getting good fahas is really important. You need to, your stage 1 faha, your stage 2 faha, your massages need to be good. What you eat post-op needs to be good, because I mean, from what I've learned as well, lipo is not a weight loss procedure. You can gain the weight right back into the places where you already got lipoed, and it can literally be like you never did anything. So your lifestyle needs to kind of match what you're trying to do. It's not magic. Nothing is magic. And getting surgery is not the easy way out. A lot of people love to think, oh, you went to get surgery because you're lazy, is the easy way out. First of all, so freaking what? You know what I mean? Like, so what I took the easy way out. I don't want to be, you know, in the gym like killing myself sweating. If there's this other option, I'm gonna take it. There's nothing wrong with that. Number 2, the type of body type that you want is not made in the gym. Gym is not gonna give you, if you want like a nice round hips, gym is not gonna give you that. Gym is not gonna make your bum, you know, if you want more volume, it's not gonna do that. The most thing gym would give you is maybe just a tiny bit of a lift, a teeny bit of a lift, and you have to do like 1 million squats to even get that. So gym does not go with everyone's lifestyle. That's not, everyone we can't all do the same thing. Whatever you do though, just make sure it's a safe option, and make sure that you are picking the correct surgeon. Make sure that you are doing your research properly. Make sure that you're ready to make the lifestyle changes necessary. I'm not saying that I'm perfect. I still have a long way to go. I'm still trying to make the changes myself. But you have to be ready to dedicate yourself and know that you don't want to just go waste your money. You don't want to waste your surgeon's effort. You don't want to waste your effort. So you have to be ready to at least sacrifice some things for a bit. If they say to you, don't smoke post-op, try to not, you know, try your best to not smoke post-op. Whatever it is, alcohol, tobacco, shisha, try to give it up. Whatever you need to give up, give it up. Because, you know, it's also going to be for your own good. I'm not saying that there's whoever's at fault, but I'm saying on the part of the surgeon, he has more of a responsibility to make sure that this patient is okay. And also the patient has a responsibility to make sure that they follow the surgeon's instruction. Now, if you have a surgeon that's just not doing great work for a lot of people, then you really need to start looking at it okay, maybe they need more training, or just something else going on. It's not normal for people to die doing cosmetic procedure. It's not brain surgery. There's no reason anyone should be passing away with cosmetic procedure. If that happens, then there's some investigations to be done. It could end up being the surgeon's fault, and it could end up being something that couldn't be prevented by the surgeon, but it's just not normal. Infections, all of that, multiple infections. If once one patient gets an infection, all right, it's just one person. It doesn't really happen often. But when you have recurring situations, that's when you really need to start paying attention and know that that is a red flag for that surgeon. Okay, so thank you guys so much for watching this video. I hope I was able to provide any information to you guys. If there's anything else that you want to know, if there's anything else that you want to find out, if there's anything else that I can help you with, if there's any way I can guide you, I'm not a surgery consultant, but I'm willing to share as much information that I have. I don't hoard information. I don't hoard anything. If I know it, I'm going to share it with you. I'm going to tell you. So feel free to ask me any questions that you have. So yeah, this is just my opinion on the situation. I'm not saying that she is at fault, but obviously even it's a tricky situation. I'm not saying she's at fault, but what I'm saying is the surgeon should have just taken a bit more care in this particular situation, you know. Anyway, I'm gonna leave it at that. Thank you guys so much for watching. I hope you enjoyed this video. I hope you liked it as well. And let me know if there's anything else that you'd want me to cover, or if there's any questions you want to ask me in the comment section. Thank you so much for watching. See you soon.